The fields of mental health and psychosocial support and education in emergencies have developed side by side and are concerned with common issues affecting children and the adults who care for and nurture them. This toolkit was created to enable practitioners in both fields to link their work more closely together, increasing synergies and impacts of their actions through access to the key resources from both fields. The toolkit brings together over 160 key resources and tools from the fields of MHPSS and EiE, including standards and guidelines, as well as training and advocacy materials relevant to practitioners in each field. Technical resources to be included in the toolkit were identified through an extensive online search, after which a selection of these was curated with the support of colleagues from around the world with expertise in both fields. We asked some of the colleagues who reviewed the toolkit for us to help us unpack some of what's inside.
The resource I would recommend to any education and emergency practitioner is probably psychological first aid that could be implemented through its different modalities in education settings. In the toolkit, for example, you can see the PFA for field workers, PFA for children, PFA for child practitioners, PFA during Ebola virus outbreak, PFA in the outbreak of COVID-19, PFA in groups, including support to teams. So 10 years after the release of the WHO PFA in 2011, I think PFA remains one of the simple, efficient, and cross-cultural, evidence-informed approach to support children, pupils, teachers, education partners in the aftermath of any adversity. In this toolkit, all the sections related to the mainstream of MHPSS into child protection and education have definitely caught my attention. In South Sudan, for example, we have developed a facilitator's guide for child-friendly spaces, communities, and schools, including trainer's guide that are mentioned also in this toolkit. We have been also rolling out a TOT training package for teachers on MHPSS in collaboration with the Ministry of General Education and Instruction. We have discussed with the same ministry on the way forward to roll out the global storybook My Hero Is You in schools as part of the extracurricular activities. Well, this toolkit is very instrumental for training, capacity building, awareness raising sessions, psychoeducation. We just recommend the users to always adapt the content of this toolkit to their realities, since we are aware that the sociocultural context, the emergency situation might be sometimes different. We recommend also the users to not only document the lessons learned or the successes, but also the challenges that they are facing when they are using this toolkit. Following their feedback, the authors will be able to improve this toolkit.
The toolkit is available on MHPSS.net and also on key websites in the field of education in emergencies.